The brain and schizophrenia. What is schizophrenia? Schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. It affects men and women equally, and some may die younger than the general population due to underlying diseases such as heart disease and others. Causes of schizophrenia. It may run in families, however, only 60% of schizophrenics have no familial ties with it, and individuals who are predisposed to it don't always develop the disease. Environmental causes may be a bigger concern. For example, prenatal exposure to viral infection, low oxygen levels during birth, early parental loss or separation, and physical or sexual abuse in childhood. Early signs in children and teenagers. Some children may develop delayed motor development, delayed speech or language development, as well as impaired social development at an early age. Teenagers may show difficulty concentrating, unexplained functional decline, loneliness, aggression, suicidal ideation, theft, and bizarre behavior. Early signs of schizophrenia in adults. Hostility or extreme reaction to criticism, deterioration or personal hygiene, flat expressionless gaze, odd or irrational statements, inability to cry or express joys, oversleeping or insomnia. Now, these are some symptoms of schizophrenia. They are categorized into two different sections. These are the positive. These are the positive symptoms of schizophrenia, which means that they are just more active. They have delusions, like beliefs that they are being watched or they are someone else, such as an actor or a celebrity or any other celebrity. Hallucinations may be in effect. They may hear voices in their head. They may see lights, objects, or peoples. They have confused thoughts or disorganized speech. They have a hard time organizing their thoughts as well. They have trouble concentrating and they can lose track of what's happening in their surroundings. For example, they may be watching TV, but they don't know what's happening. They also have movement disorders that can seem jumpy, perfectly still, or can be perfectly still for a stretch of hours. Now, as for the negative symptoms of schizophrenia, these are the lack of emotions. So they may have a lack of emotional expressions, like an inexpressive face, including a flat voice. They may have lack of eye contact or blank or restricted facial expressions. They may have lack of interest or enthusiasm, like problems with motivation or lack of self-care. They may be seeming of lack of interest in the world, apparent unawareness of the environment or social withdrawal. And they may also have speech difficulties and abnormalities, like inability to carry a conversation, short and sometimes disconnected replies to questions, and they speak in a monotone. Now, treatment for schizophrenia. There is no actual real cure. It does require long-term treatment for the rest of your life, so it is a long-term treatment plan. You can use medication, therapy, or seek social support. But most importantly, you should have self-help. Learn how to self-help, and you can manage your stress, use regular exercise, get plenty of sleep, avoid using substances like alcohol, drugs, and nicotine, and eat nutritious meals. If you know a loved one or someone that you care about that is experiencing any of the symptoms of schizophrenia, please help them seek help. You can seek medical attention through their primary care physician who might be able to help them get the right resources, or you can contact the National Alliance on Mental Illness helpline at 800-950-NAMI for referral services. You can also look for your local treatment advocacy centers, and they'll also help you find the correct course for action. Thank you.